Thank you very much indeed, and thank you for inviting us back. So what we're going to be talking about is this business of writing a good funding proposal. And I've done a session similar to this a couple of times at these training sessions, and previously I worked with somebody called Justine Tomlinson, who got her first RFPB grant while she was... is this okay with feedback? Yep, okay, fine. While she was doing her doctorate. And she's now, I'm very pleased to say, off on parental leave for a year. So Matthew has very kindly agreed to join me as an example of a mid-career researcher. And then the other day I discover he's been made professor. So I'm sorry, Matthew, this is probably your last opportunity to be with me as an example of an early or mid-career researcher. But I would like to positively reframe this as a wonderful example of how stratospheric your career can be if you get an RFPB grant. Okay, so this is us. So we're going to talk a little bit about... could I have the next slide, please? Oh, no, I do it. I'm sorry, I haven't got people, have I? I need to do it myself. Goodness. This is so hard for me. Okay, so we're going to talk about the NIHR Research for Patient Benefit programme, which is not to be confused with the fictitious programme that you're going to be applying to. I know it sounds an awful lot like it, but this is a real programme. I'm going to give you some tips for successful applications. And then the way that Matthew and I are going to do this is a kind of in conversation. And he's going to try to think back to what it was like when he got his first grant in 2013 with RFPB. And we'll talk about things like identifying a research question that matters, deciding when's the right time to apply, getting help, engaging with patients and the public. We can probably do that quite quickly, having had that fantastic talk from Una and Paula. Getting the applicant team right and learning from experience. So that's where we're going in this session. All right, so the RFPB programme, it's a response mode funding programme. We do sometimes put out highlight notices, but generally speaking, if you've got a really good idea, you can come to RFPB 3 times a year in your local region. There's really no limit to the range of qualitative and quantitative designs that we will look at. And the programme now includes research for social care, which is currently an annual call to support social care research. Now, the grants come into these 3 tiers. If it's at the highest tier, which we call Tier 1, up to 350,000, that's got to be pretty close to patient benefit. Whereas at the middle level, that might include feasibility designs and work which is very clearly some way on the pathway to patient benefit. But at Tier 3, things get really exciting, up to 150,000. That's where we're really keen to fund more exploratory, upstream activities. So it might be methods work, secondary analyses, reviews, intervention development. And that's a really good tier to apply to as an early career researcher. Okay, and I've mentioned we've got 8 regional advisory committees, and they each have 3 funding competitions a year. So at any moment, you can be preparing one of these applications. Isn't that wonderful? And we funded something like 1,050 awards so far, and I'm in the middle of a 2-week cycle of committees at the moment. So there'll be yet more by the time I finish this talk, probably. It's very exciting. Okay, so we are interested in research projects that matter to the NHS and social care and to patients and the public. And one of the things that I find myself saying often is that as applicants, I want you to show us where is the appetite for this study. Okay, apart from it being a jolly good thing on your CV and developing your own career. You know, we really want to know how it's going to be used, who wants the findings. And amongst the many designs and topics that we would consider would be how services are provided and used, what matters to patients, service users and staff. You know, we might fund studies of the effectiveness of interventions, of course, and whether existing interventions perhaps provide value for money, looking at different ways of providing care. We also look at quite a lot of feasibility designs, but the things that we're interested in feasibility designs, is what are the specific uncertainties that matter as far as running this larger trial is concerned. We really don't like seeing off-the-shelf designs. We like people to come along having identified, the difficulty here with running this trial is going to be at this particular point of whether the surgeons will be willing to randomise, for example. So, tell us what matters in your study. Working with PPI, just talking to people, listening to people can be incredibly useful. And you might also want to come to us to identify new methods for research, and we're funding a few developments of core outcome sets at the moment, particularly in the lower tier. And, I'll put this in bold, early career researchers are actively encouraged to apply. And not only are you actively encouraged to apply, but we're actually really keen to fund you. We don't just want you to have the practice of filling out the application form in all its joy. People in the room who've sat on RFPB committees will recognise that when we're looking at proposals, when we can say, it's an early career researcher, everybody looks at it with increased enthusiasm. Okay? A few tips before you start writing. Now, we all have different ways of writing and organising our thoughts. I find it incredibly useful to chart. Before I start writing the proposal, I chart each objective. Then for each objective, why it is in the next column that objective matters. In the next column, who it is on my team who has the expertise in that area and the method they're going to use. And the final column would be how this links to the next objective or another part of the study. And I feel that if you're working with a research design which has maybe 4 objectives in it, if you chart each objective and think about why this matters, who's going to do it, what method I'm going to use to address the objective before you start writing the proposal, and have those discussions with your colleagues and PPI representatives, then you will write a much clearer application. And you want to write a very clear application. The people who are assessing your application will be, favourably disposed, but if they find it difficult to match up what you say you're interested in and the methods that you're using, you will lose them. Second, write for a general audience. Don't expect everyone, indeed don't expect anyone on the committee necessarily knows your field as well as you do. Make it really clear in the first paragraph why this matters and to whom it matters. Make the case clearly. Where's the appetite? Find out what it is the funder is interested in and take the time to learn the process and absolutely take the time to address the feedback thoroughly if you get through from stage 1 to stage 2. Or even if you get, if it gets turned down this time, look at the feedback really carefully and think about how you can address it. Now, one of the reasons why this is important with funding bodies like Research for Patient Benefit is it is exactly the same committee, the same bunch of people who gave you the feedback at stage 1, who will be looking at your response to the feedback at stage 2. You are intelligent people. I do not need to spell it out for you. It is a very, very good idea to either do what they suggest or politely engage with it and explain why it's not a good idea to do what they suggest. And I think you can do that. You can do that well. You don't have to follow everything the committee suggests, but don't hope that they won't notice that you haven't addressed something, because, as I say, it's the same people. And if the lay summary is the first thing that everybody looks at the application, and I'm with former programme director Paul Little on that, it's definitely the feedback to the stage 1 comments that everybody goes to first when it comes to stage 2. Now, about a fifth of applications to Research for Patient Benefit overall get funded, but it's about half of those that reach stage 2. So if you do get invited to stage 2, it's worth spending the time thinking about it. Okay, so we have on the NIHR website a few case studies of people who've applied to RFPB for funding. And Matthew Ridd, who's going to appear any second, was under this myth-busting heading of GPs can't apply for research funding. Can they? It's so tempting, isn't it? So, Matthew, I'm really hoping that you're going to be heard now. I would like you to tell us a bit about how you found out that RFPB was a potential funder for your research all those years ago in 2013.
Okay, thank you, Sue. I take it you can hear me. That's a good start. Excellent. So I'm a GP by background. I still do a day-a-week clinical practice. And as Sue says, it was a few years ago since I applied for my first RFPB grant, but it feels not that long ago. At that stage, I was probably about a year or two past my PhD. I had maybe one or two smaller grants around sort of 50 to 80k mark under my belt. The idea I had at the time fitted with the program. It was in the right kind of amount of money, both in terms of what the program would fund, and it was also kind of the right kind of amount of money that I was looking to, because it's possible that you're a genius and very trustworthy and could be given a 2 million grant straight after your PhD, but unlikely. If you can demonstrate a track record, that helps. I think ideally, if this is your first grant, my advice would be, as I did myself at that position, was to try and do some work around it. So I knew some people who were on the committee, so talking to people who sit on the committee really helps. I didn't have the benefit of Sue's talk. You probably would learn as much from this talk as you would from talking to any committee member, but it still helps if there's someone in your institution. That's not to curry favour, that's just to find out how they perceive the process and so on. And if you can be a co-applicant on a grant before you write your own, all the better, because it just gives you that bit of insight. And I also had the advantage that by that time I'd actually got myself onto the Southwest Committee meeting. So again, having that advantage of having sat in the committee, reading other people's applications and seeing the process of the committee really helped me understand what to expect, because it really helps if from the outset you start to see it from a panel's perspective, from the committee member's perspective. I think that'll do for now, Sue, that's all right.
That's fabulous, thank you. And, and a great plug. Yes, we want new committee members, and you really do learn from it. Okay, so what does a funding panel look like? And I've said it's really important to know the assessment process when you apply. Well, for a responsive mode funding scheme such as Research for Patient Benefit, you typically have around 20 members with a range of backgrounds. Now, the methods expertise is absolutely vital, and because we fund pretty much all designs, we always need statisticians, trialists, qualitative researchers, health economists. We also like to have a good range of clinicians on the panel. So I always find, and I'm not just saying this because I'm doing this with Matthew, but I always find it's really useful to have a GP on the panel. Also really useful to have somebody who works in secondary care, nurses, psychiatrists, other allied health professionals, and of course there are always public members on the panel. So that kind of mix of expertise. Typically, you would have a few people on a regional panel who might have some conflicts of interests. And that point about talking to the person down your corridor who has sat on the committee is a really good idea, because they'll have a conflict of interest and will have to be out of the room when your application's discussed anyway. And generally people are quite happy to share their knowledge. The slight difference is the Research for Social Care Committee, which is entirely comprised of social care researchers and practitioners. We did start off trying to review social care research applications on the usual health services research-dominated panel, and we realised we weren't terribly good at it, even if we had one or two social care researchers in. So now we've got this specialist panel. So if you are a social care researcher, that's the one to apply to, I would suggest. Okay, so next slide. So the research question. I know you've had a little bit about framing research questions at the moment. For RFPB, I think, I keep drumming home this idea about why does this question matter? Really think about that and make sure you've got that right. What's the trajectory from your question to ultimate patient and public benefit. You know, really think that through, because you may think it's completely obvious, because you know your field very well, why this bit of work you're doing is going to improve the world. But spell it out, you know, show us, because people are looking at a lot of grant applications in the same day. Will the methods that you've selected provide a clear answer to the question? And one of the benefits, I think, of this charting method that I use is that you always want to go from what are the objectives of this research to define what the methods are. And I mean, I'm a qualitative social scientist, and there would be a danger for me to think, what I need in this study is to do some qualitative social science and then work back from that. That, you know, you'll realise that is not the way to do it. If it's quite clear that to answer your question, you need to have, you know, a cost consequences analysis, then, you know, there are lots of really nice health economists who will help you out with that. But, you know, always start with what is needed to address the important question that matters, not, you know, not starting with the methods. And then is the cost of the research commensurate to the risk that it won't deliver? And as I say, at tier 3, 150,000 for an early career researcher, you know, I would like to point out there is no other circumstance in which I would refer to 150,000 not being a huge amount of money. You know, I'm not particularly grand, but, you know, it is much more acceptable to, you know, to learn something with the project and be a little bit further away from patient benefit than if you're asking for a couple of million, no matter how trustworthy you may appear. So Matthew, would you like to tell us something about defining the research question and also deciding, you know, what point to apply?
Yeah, so for my money, my experience since my RFPB grant, this is the most important stage because everything flows from it. And if you get the research question right, then it can make the everything from that follow, either in terms of the methods or the people you work with and so on. It's an iterative process. So if you've read a good application or a good paper, I can guarantee you that's probably version 13 or 14 of it. Good applications and good papers have lots of iteration how to do research questions, I think. I think maybe as a clinician, for the clinicians in the audit, you may have some advantage in the sense that in the everyday course of your work, you'll be asking yourself hopefully questions, or patients may be asking you questions that you think, well, what is the evidence for that and why am I doing that? Otherwise, I think really good sources of questions are NICE guidelines, and Sue will correct me, but I think it's true for all NIHR programs now. They're inviting applications, researcher-led applications directly from research recommendations in NICE guidelines, and also James Lindenlight's priority setting partnerships. And certainly that's where my idea that got funded through the RFPB came from. That was from a research priority identified through a priority setting partnership, because immediately that underpins a number of the questions like where's the patient involvement? Well, this has come out of a joint exercise through patient and clinicians. You know, what patient involvement has there been? Well, this started from the ground up, as it were. And again, if you're active in a particular disease area and there hasn't been a PSB or can get involved in one, I'd encourage you to do that because you've got the inside track before the questions come out. You already know, you know, what questions need to be answered. All right.
Fabulous, thank you. Yeah, doing great. Okay, so have I just gone too far? Yes, I have. Two-stage process I want to tell you a little bit about. So it's stage 1, and you've had a bit of an insight into this from Una and Paula about stage 1 and stage 2. But I think it's useful to know about how we go about assessing the applications. So at stage 1, we're interested in, you know, the relevance of the research question to patients in the service, whether the method in general is appropriate to achieve the objectives. And we also, you know, we were talking about embedding the PPI. I mean, we are concerned about whether the amount of data collection, whether the methods are going to be onerous to the participants. So, you know, when you're designing things, don't think, oh, we'll just throw in another couple of video diaries and sets of 150-page questionnaires. You know, actually think about that because it's a very easy thing for the panel to pick up on. And, you know, are they appropriate? We also think at stage 1 whether the amount of improvements that would be required to make this a competitive stage 2 application are reasonable for the kind of 6-week period that you get between your stage 1 feedback and putting in your stage 2 application. Funding panels can often redesign projects very competently, but we do not ask them to redesign. We ask them to phrase the feedback that you should maybe think about whether this is a trial that needs to have a cluster design, that you need to think about whether you've got sufficient funding for the poor benighted research assistant who's supposed to be doing all this work that the professors on 1% each are leading. And those things will be looked at, and we'll get an idea about how many of the... We love alliteration in NIHR, so are they fixable faults or are they fundamental flaws? If it's a fundamental flaw, even if the idea is great, you will get some feedback along the lines that, you know, the panel thought this was a terribly important area, but no. But the fixable faults, as I said, pay attention to those. At stage 2, it will be a longer application form, so there's more detail. You know, you've already been warned about taking the time to transpose from your Word document to the form. A lot of your formatting may well disappear, including a lot of your white space. So do not do this at 7 minutes to the deadline. You know, do it a couple of days before. And when you're reviewing the final editing, do that on the application form on the website, not the one on your laptop. And it's the same committee. And at stage 2, there will also be external reviews sought. So, you know, we've got these very good committees, lots of different experience, but we probably won't have somebody who's got the particular clinical experience in your particular area, so we will be looking for a clinical reviewer. We will be looking for, you know, specialist methodologists. We will also be looking for external lay reviewers on each application. Now, at the end of that, you will get a recommendation for funding. Now, something that I think it's really useful to be aware of is that both at stage 1 and stage 2, you will get a link where you can see where your application fell in the order of the funding on a transparency table. Look at that. Do look at it. Because if your application was one of a few that scored 2, please don't give up research, but please find another idea. If your application was one that scored 6, you know, then it may be that it only just missed funding. So that means it's really worth making an effort to come back, because it probably will be funded next time. So look at the, you know, make sure you click on that link. Look at it. It's useful information for you. Okay, and there are lots of resources for you. I mean, we you know, I'm sure you know a lot about what the Research Design Service can do for you. Contact them early. Again, patients and public, obviously, voluntary sector, senior colleagues and mentors. We've mentioned people who've sat on the panel before. And please do talk to the Research for Patient Benefit and Research for Social Care programme managers. They are fantastic people, and they can never really understand why it is they don't hear from potential applicants more, because goodness, they've got a lot of knowledge, and they sit on the funding committees, and they've seen pretty much every mistake anybody can make. What is important to know is that if you phone them, your name does not go down in a Dickensian ledger of, you know, the researcher who dared to ask. You know, we actually all regard this as a rather good thing and a good sign for your career. Okay, so Matthew, would you like to tell us a bit more about engaging with PPI Research Design Service and colleagues?
Yeah, I'll keep this brief, because the PPI section for this was excellent, and I think if you can absorb all of that, 'cause there was a lot to absorb, then you will go far. But certainly, you know, identifying a group, representatives, people you can go to discuss your ideas with early is really helpful, because, as I said, if you start with the research question and, you know, co-design it is the ideal, obviously, with the end users, patients and clinicians. Then you're in a stronger place. I personally haven't needed to seek advice through my RDS service locally. I'm sure they're lovely people, but I think that reflects that, as will be the case for you, that what resource, what support you have to hand will vary according to your project, your stage of career, and your institution, and so on. The idea I had funded initially through the RFPB, and most of my work subsequently has been trials based, and for that reason, I've worked closely with the trials unit. And for me, being able to focus on the important things that I think that I'm good at, or only I can do when leading a bid, like writing the grant application, and being able to lean on someone else within the trials unit, in my case, in terms of helping with SOCAT forms and all the other bits that I personally really struggle with, has been really important. So, none of us can be everything. So play to your strengths, and if you can identify people around you and the RDS or other resources who can, help you with the bits of the application you're going to struggle with. Intellectual property, for example, is another one that I always seek help on. Then do that. That would be my advice. And as I've said before, always a really good place if you've got colleagues in your institution, ideally who've applied to the RFPB scheme, if that's what you're aiming for. But I think it's true for certainly all my experience of NIHR programs. It's a very similar, HTA program, but very similar kind of approach, really, in terms of the things that Sue's highlighted that you need to think about when writing an application form.
Thanks, Matthew. Great advice. Okay, so the next one is on getting the applicant team right. Now, people often ask about this because, I say we really encourage early career researchers to apply. We do not do this to be horrible to them. We want it to be a good experience when you apply as an early career researcher. And therefore, we really like to see that there is a team that is going to be able to support you. And we want to know which of the seniors who might be on your application with you is going to perform something like a mentor and support role. And that person needs to either have a suitable percentage full-time equivalent, or if the person who's giving you that support already has a fully funded post and does not need to have their slice of your 150,000 as an early career researcher, write it into the application. Explain that, Professor, Sir, Dame, whoever, is giving you support as part of their role in your department, running your group, as part of your mentor. So you can explain that, and we don't insist on giving people money to people who are already paid. We're very even-handed like that. Getting a long list of senior colleagues at 1% isn't usually well received by panels. It may look a bit suspicious. And also quite often people on the panels, particularly the regional panels who will be looking at, regional applications, they'll probably know who some of these people are. And, and it may not seem credible that they're going to give you an awful lot of support. So, make sure you've got a good, crisp team who will actually do the work. The team needs to reflect the nature of the work. If there are gaps in method skills or under or over costing, do you know what? That's going to be picked up. Because even if you haven't entirely engaged with reading all of the applications at the committee, if you're a health economist, you can very quickly scoot through an application and see whether somebody's planning to do some health economics without having an appropriate percentage of a health economist board. I would do the same for qualitative research. I can very quickly absorb whether, it's being done properly. So really think about that. And make sure that everybody's got a clearly described and differently described role. I mean, you do sometimes still see applications where the role of everybody is to help with the research. Yeah, well, we were kind of assuming that. Tell us particularly which bit they're taking responsibility for. And if you've done your chart, I really do sell my chart, there will be that line next to the objective and the methods where you say who's got that expertise. Okay, so Matthew, tell us about how you got your team together.
Yeah, so my advice, and to further sell your chart, Sue, I agree, because my advice would be to be careful who you invite, because I would say that there's one thing worse than not getting your grant funded, is to get it funded and then not realise that you've not got the people around you to help you deliver it. So I've seen grant applications where you've got don't know, 5 or 7 professors listed, and it's not clear actually who's actually going to help deliver the research. Certainly there can be an element whereby there might be people who are part of your team who look good, but I think also most funding committees are very aware that you have to provide good evidence they're actually going to provide the support, or they have a clear role for you. So just getting people in your department who've got previous grants on the honours application won't be enough. You need to explain why they're there. And being really clear about who's doing what. At the stage I applied, I was concerned that the RFPB wouldn't be willing to give me £350,000, but again, support my unit said yes, and we had a senior lead, and said as much in the application, and I think that helped support me as someone who's relatively junior, not having managed that kind of money or a trial at that stage.
Fabulous, thank you. Okay, so clearly quite a lot of applications do get rejected. Please remember that it is not you who has been rejected, it is the application that's been rejected. And the sorts of reasons why you might get an application rejected are failure to demonstrate that this topic matters and to whom it matters. Sometimes research questions are a bit ill-defined, unfocused, maybe unsupported by preliminary data. I mean, if you're going to do a literature review, and you've got to try to cost that and time it, it's a really good idea to get at least an initial idea of how much literature there might be out there. So, that I think is worth considering. If the research team lacks the relevant experience, I've said that's very, very easy to spot. The inadequate response to stage 1 feedback, I've mentioned. Omission of critical literature. I think it really is worth thinking, what is it that people sitting on a funding committee can look up as they're sitting in the committee? You can look up whether there's a discipline missing. You can also do a very quick online search. And if you're applying for a trial and you're saying nobody has ever done a trial in this, and somebody sitting around the room can say, oh, I've just found a trial that published, in the New England Journal 3 months ago. That's going to undermine everybody's confidence that this is worth doing. So, really think about how you make your case and what people will be able to find out easily. Unsuitable methods, insufficient detail to convince reviewers that the team knows what it's doing. Now, at stage 1, you don't have so much space, so you've got to be, really clear, but you can give more detail at stage 2. Insufficient recognition of potential problems. I think that there's a tendency, sometimes early career, to be quite bullish about the likelihood that you're going to be able to recruit everybody who you're hoping for in your study. I think actually committees are much more impressed by people who say, this is one of the real uncertainties. This is why we're doing some feasibility work first, because we know the patients are there, but we don't know whether they will be willing to have a washout period before taking more medicines or whatever it is. So I think that if you can show the reviewers that you've thought about some of the potential problems and you have some way of approaching them, that just makes us more confident that you're going to be a suitable recipient of public money. Poor proofreading, contradictions, poor flow. I really dislike applications which have 18 objectives, 5 work packages, 3 phases, and then suddenly some random letters, A, B, C, J, and X, describing different, I keep it simple. It'll be much easier to get your point across. Okay, so, Matthew, what have you learned about writing a grant application? This is your final reflections.
Well, so, easy to say, but important, I would say start early. One advantage of the RFPB program is that it does come around 3 times a year. So again, I was all programmed to go for one application deadline, realised I wasn't going to hit it, so had the benefit of another few more months and then submitted a better application. I think it's much better to take time to submit a good application at the start rather than something that's half-baked, because you're probably just wasting your and potentially the committee's time. My advice would be always to write long. So don't try and necessarily write it to the length of the application form. for two reasons. First of all, because it really helps you think everything through, because it's very easy otherwise to miss a detail that you need to cover in stage one, or to miss a costing that you need to cover in stage one as well, because the committee won't be impressed if you suddenly come back asking for an additional 50 or 100,000 pounds, having said you could do it for a lot less. And related to that, really, allow time for money. So again, my first bid failed spectacularly because I think the application was quite reasonable, but the cost came in very last minute and we're all over the place, and we were about £1 million too expensive, and surprise, we didn't get a look in. Most institutions, or perhaps your RDS or other ARCs or so on, probably have courses to help you grant write. So you haven't been on one. I benefited from doing that at an early stage. When you're writing it, you want to aim high. You're not looking for the middle kind of grades, because chances are you're not going to get funded. If you need to be aiming for a B+ or A or whatever grade the panel's working to. Try and see it from the panel's perspective. When you're working really hard to a deadline and you're trying to collate 15 versions of the same document from if co-applicants and the finances are still aren't in, and so on and so on, it's very easy to feel poor me, but actually see it from the panel members' perspective. They're all very able, clever people, but they're probably fitting this around their own busy trials and grants. They'll probably be reading this a bit tired, fed up, having maybe read a previous application that wasn't very well written. So if you can present them with something that's really easy to read and for them to understand and enthuses them, you'll be doing yourself a benefit as well, obviously, benefit for them as well. I'm not suggesting that people won't critically try and look for what you're trying to say, but the easier you can make it, I think the easier it makes it for them. And even down to the kind of details that PPI colleagues were mentioning around the use of white space. Sometimes less is more. If it's readable and you've got the key things in there at stage one, you can hopefully have some more space for the detail at stage two. Writing the PPI in throughout, I think, is really key as well. There's a box there to give you a bit more detail around what you've done and what you're going to do, but I think it really should be present throughout if you've done it properly, not sort of tokenistically. And also the advice around writing the plain English summary is really key as well, because again, certainly from having sat on grant panels then and since, if you don't know anything about the topic, that should be the easiest thing for anyone to engage with it. And if us as reasonably intelligent, educated people are struggling to understand for the plain English summary why they're doing it and how they're doing it, then chances are the rest of the application isn't going to save itself. And I suppose, is this my parting shot, Sue?
I think it is, yes.
Yeah, okay, that's right. So my parting shot would be rejection is inevitable, I'm afraid. I remember talking to a senior colleague who was very successful, and he reckoned his hit rate was about 1 in 3. And I think that's probably a reasonable rule of thumb. But my 3 bits of advice otherwise would be to try again. The colleagues that I see that have been successful, have been resilient and persisted. Now, don't keep hitting your head against a brick wall. There's no point resubmitting something that was rejected with the same problems as last time. You've got to work in the feedback and learn from rejection, but persist, because persistence will pay off if the basic idea is good.
Thank you so much. And that's actually evidence-based as well, that last comment. Some of you may have heard of the Matthew effect. I mean, this is basically those people. This is an analysis of people who got just above and just below the funding cutoff. And if you look at what happens to their careers over the following years, you will discover that those who came just below tend to stop submitting applications and don't raise very much funding. Whereas so this could be, a tiny difference in the success of the early application, but in one case people are encouraged by their success and they keep applying, and they're the green lines shooting off to a sort of happy future, and the red lines are those who just felt very discouraged for a while. So please don't feel discouraged, please don't feel you've been rejected, just learn from it, revise it and come back. We'll be happy to see you. Thank you very much. Thank you, Matthew.
Brilliant. We'll go straight to the delegates who will disappear in 3 minutes.
Oh, 3 minutes! Oh goodness, I didn't leave much time.
Matthew that needs to disappear in three minutes.
So it's Matthew that will disappear, yes. Not the delegates.
Yeah.
So, Matthew, thank you so much. Again, first time we've done this, I think it worked really well. So, thank you.
Thank you.
If we don't get to you, you may be answering a question.
So, one question. Is it advisable / permitted to apply for an RFPB grant during a clinical doctoral research fellowship?
Yes.
Well, there you go. That was quick.
Well, whether it's advisable will partly depend on, what else you're doing with your time. But if you've got a good research question that matters, absolutely apply. We'll be very pleased to see you.
And a follow-up, would medical education research be considered appropriate for Tier 3 RFPB?
Medical education research would be considered appropriate for any tier.
Brilliant. Thank you.
For the avoidance of doubt.
And that's specifically for the people from the incubator from the medical education research group.
Of course.
Okay, one more. Is it possible to apply for an advanced fellowship at the same time as an RFPB grant?
Can't see any reason why not.
Okay.
Can you see any reason why not? No, Lisa says yes, I'm fine.
I think that's all our virtual questions.
Wow. Brilliant. Do we have any questions from the audience? Yes.
Hi.
How did it apply from Northern Ireland?
Oh dear, sorry. There is a separate scheme in Northern Ireland, also a separate scheme in Wales. So for RFPB, I'm afraid that is England. Although you could be part of a team applying from Northern Ireland, but the whole team couldn't be from Northern Ireland. So we do sometimes see applications which are, and I assume that they're a real PI, based in England, but with colleagues in Ireland and Scotland. And there are some research questions that, of course, will really benefit from that because clinical practice may be different or, policies may be different. Thank you.
Hi, can you submit the same idea to multiple schemes? So could you apply for a fellowship with the same idea as an RFPB grant? I think it follows on from another question.
If it's exactly the same idea, then I think we would expect that you would wait to find out about the funding from one before the next. And I suppose committees tend to spot something which they think is a failed fellowship application when it comes to the committee, usually because there's a very high full-time equivalent for the lead researcher. And, there may be cases where, I don't know, if you were an ethnographer, for example, doing a sort of anthropological type study, then it might be very reasonable to have 100% of the lead researcher funded. But I would certainly change because fellowships and project grant applications do tend to look rather different. Fellowship applications are much more about the person, and it's not that in project grants we don't care about the person. We care desperately about the person, but the funding is about the project, and so we're not, we would be expecting that the people who are funded on it would probably have most of the skills that they needed to deliver the project. The lines here are probably a little bit fuzzier than, because actually if somebody is appointed to a study and they need to do a bit of training on a project grant, that would be fine, but it's not, you don't usually get your training through a research project. Talk to us or talk to the programme managers if you're not sure.
Any other questions? So I'm going to look to Karen. Do we come back at...
So I think everybody here would probably need a 15-minute break.
15-minute break,
yeah.
so we're...
so shall we, what does that make it then? 45 past, yeah? Quarter two?
Quarter two for presentation skills. And so can we thank Sue and Matthew, who I think has disappeared and turned into a pumpkin.